But first at 5, Ohio's newest COVID numbers are out, and it's been another high caseload count across the state. 4,876 cases were reported overnight. That's about 200 above the 21-day average.
As for our hospitalizations, after just 113 new hospitalizations over the weekend, that number doubled over the last 24 hours as we reported 241 new COVID-19 patients statewide. Currently in the state of Ohio, there are more than 3,000 COVID-19 patients. And just for context, on average, that is 35 patients for each of Ohio's 88 counties.
Well, senior health correspondent Monica Robbins joins us now.
Monica, good afternoon to you. We want to focus on specifically the children and how this Delta variant is impacting kids. Last year, I remember you saying that children hospitalizations were very, very rare. How does that compare to what you're seeing today with the Delta variant?
Well, we saw it happening in the South, and now we're starting to see it happening in Ohio, and it's really concerning. There are 70 kids currently hospitalized across the state of Ohio fighting COVID-19, and today, the presidents and CEOs of the state's 6 children's hospitals gave an impassioned plea to Ohioans to take this virus very seriously and protect the children who can't be vaccinated or vaccinate those who can. So last week, they all signed an open letter through the Ohio Children's Hospital Association saying more kids are in the ICU with COVID than ever before, and staffing is being stretched thin. They also say the Delta variant is impacting kids at a much higher rate than before, and they're worried about the upcoming respiratory virus season as well.
At Akron Children's, some of the things we're seeing are about 12 to 15 kids hospitalized per day in the ICU and also on ECMO. Last week, we tested over 3,300 children with 254 positive and 500 more pending results, so that could go higher.
We had the highest number of children seen in our Rainbows campus, emergency room campus, on main campus, that we had seen in greater than 5 years. So we're definitely experiencing something that is very, very different than last year, and very, very different than past RSV seasons.
Well, Kolchik added that since the middle of August in Summit County, more than 1,100 school kids and staff have been quarantined for COVID exposure. That's compared to just 23 for schools that mandate masks. They stress that masks are safe for kids and should be worn in school, especially for those too young to be vaccinated. And the bigger concern is we haven't seen the end of this wave, so they're really worried about cases skyrocketing now that we've already gone through the Labor Day weekend.
Yeah, and we've got just enough school under our belt to get everybody kind of in the same rooms together for sure. You know, one of the big complications that came out last year that was pretty scary for parents to hear about is this inflammatory side of this illness. Is that still the case? Is that inflammatory complication still out there?
Yes, it is. But the bigger concern is we don't know what's going to happen with Delta right now, because the other concern, that multi-system inflammatory syndrome in children known as MIS-C, that shows up about a month or two after the child seemingly recovers from COVID. So what's concerning is that it's just too early to tell right now. So they're urging Ohioans to go back to the tried and true measures of masking, social distancing, and hand washing, and they're hoping parents get vaccinated to protect the kids who can't.
All right, speaking of vaccines, any idea on a timeline for when we might start to see children 12 and under be able to have the vaccine?
Listening.
Listening.
Very carefully.
Yeah, you know, I actually got some good news out of the CEOs today. So the CEO of Cincinnati Children's, they were on the front lines of testing those vaccines, and she is very hopeful that at least one will receive emergency use authorization for kids 5 to 11 in the next 2 to 3 months, hopefully before the new year. But that's what we can expect right now, and that's kind of what we've been thinking for a while.
So buckle up. Hold on. We're not done.
Wear your mask, socially distant, especially if you have kids, you know.
Wash your hands, wash your hands.
Come on,
I shouldn't have to prompt you for this.
What? Seriously, it's like, I've said it so often for 20 some years that, you know.
And now you're 20 some months into it.
Everybody else is saying it for me, so thank you.
All right, I got you. Thanks so much, Monica.
You were way ahead of the curve.
So.
Exactly.